Acrophobia. Acrophobia is one of the most widespread and well-recognized phobias. It refers to an intense and irrational fear of high places such as tall buildings, mountains, bridges, or even climbing a ladder. People with this condition experience not just discomfort, but overwhelming anxiety that can manifest physically through rapid heartbeat, sweating, dizziness, nausea, or even fainting. The brain interprets being at a height as a life-threatening danger, even in safe situations like standing on a balcony with protective railings. Acrophobia can seriously affect someone's daily life. For example, they may refuse to work in an office located on an upper floor, or avoid traveling to scenic areas with cliffs or viewpoints. This phobia often develops from a combination of genetic predisposition and personal experience, such as a fall during childhood or witnessing someone else fall. Treatment usually involves cognitive behavioral therapy, CBT, where patients gradually expose themselves to height-related situations while learning relaxation and breathing techniques. Virtual reality has also proven useful by simulating heights in controlled environments. Over time, successful treatment helps individuals regain freedom in activities that were once impossible due to overwhelming fear. Claustrophobia. Claustrophobia is a persistent fear of being trapped in small or enclosed areas where escape feels difficult or impossible. Triggers include elevators, tunnels, airplanes, or small rooms with no windows. When exposed to such environments, individuals may panic, feeling shortness of breath, chest tightness, trembling, or dizziness. In severe cases, they might avoid using elevators entirely, choosing to climb several flights of stairs rather than risk feeling confined. It often originates from childhood experiences, such as being locked in a closet, stuck in a crowded place, or traumatized during a power outage in an elevator. The fear is not always about physical confinement. Sometimes it stems from a broader fear of losing control or suffocating. Treatment often includes gradual exposure therapy, where patients practice entering confined spaces step by step, combined with techniques to regulate anxiety such as mindfulness and progressive muscle relaxation. Cognitive therapy also helps reshape irrational beliefs, like the idea that elevators are guaranteed to malfunction. Overcoming claustrophobia restores the ability to travel, use public transportation, and participate in everyday activities without fear of being trapped. Arachnophobia. Arachnophobia is one of the most common animal-related phobias. It involves an exaggerated fear of spiders, regardless of whether they are harmful or harmless. While spiders play an important role in ecosystems by controlling insect populations, individuals with arachnophobia perceive them as dangerous predators that must be avoided at all costs. Symptoms include intense panic, sweating, rapid heart rate, and the urge to escape immediately upon seeing a spider. Some people even react to spider webs or photos of spiders in books and media. Researchers believe this phobia may have evolutionary roots, as early humans who avoided venomous creatures had a survival advantage. However, in modern times, most spiders encountered are not life-threatening. Treatment options include systematic desensitization, where exposure begins with looking at pictures and eventually progresses to being near a real spider. Virtual reality simulations have become an effective tool, letting patients face digital spiders in a safe environment. Through therapy, people learn to replace irrational terror with a more balanced understanding, eventually tolerating or even calmly removing spiders instead of experiencing full-blown panic. Aviophobia. Aviophobia, or fear of flying, prevents millions of people from boarding airplanes, despite the fact that air travel is statistically one of the safest modes of transportation. The phobia often arises from a sense of losing control, turbulence, or news reports about aviation accidents. Sufferers may experience anxiety days before a scheduled flight, with sleepless nights, intrusive thoughts of crashes, and physical reactions such as sweating, shaking, and difficulty breathing once inside the aircraft. Some refuse to fly altogether, severely limiting their personal and professional opportunities. Interestingly, aviophobia may combine multiple fears: claustrophobia because of the confined cabin, acrophobia because of high altitude, and fear of losing control. Treatments include cognitive behavioral therapy, relaxation training, and controlled exposure such as sitting inside stationary aircraft for practice. Some airlines even offer fear of flying courses, teaching passengers how planes work and demonstrating safety measures to build confidence. Nyctophobia. Nyctophobia, or fear of darkness, often begins in childhood but can persist into adulthood if untreated. People with this phobia associate darkness with hidden threats, danger, or the presence of something supernatural. Even in familiar environments, such as their bedroom, sufferers may feel unsafe once the lights are turned off. Symptoms range from increased heart rate and sweating to difficulty sleeping, nightmares, or outright refusal to enter dark rooms. Evolutionary psychology suggests that this fear developed because darkness historically increased vulnerability to predators. Traumatic experiences, like being left alone in a dark place as a child, can also intensify the phobia. In modern life, aniactophobia can cause chronic insomnia, reliance on nightlights, or avoidance of nighttime activities altogether. Treatment focuses on gradual exposure, such as dimming lights slowly rather than turning them off abruptly, combined with relaxation methods to reduce anxiety. Cognitive therapy helps challenge irrational beliefs about what lurks in the dark. When managed successfully, overcoming aniactophobia allows for restful sleep, improved health, and a more balanced daily routine free from unnecessary fear. Hemophobia. Hemophobia is characterized by an intense fear of blood that can cause unique physical responses. Unlike most phobias, which raise blood pressure and heart rate, hemophobia often triggers a sudden drop in blood pressure, leading to dizziness or fainting. Even small cuts or medical procedures like vaccinations may provoke extreme reactions. Sufferers might avoid hospitals, refuse essential medical treatments, or panic at the sight of accidents. The origins of hemophobia may lie in both genetic factors and traumatic experiences, such as witnessing a serious injury during childhood. Symptoms include nausea, sweating, trembling, and loss of consciousness. Treatment focuses on teaching patients how to counteract fainting by applying muscle tensing techniques to keep blood pressure stable. Gradual exposure to images and medical settings also helps reduce fear. Cognitive therapy reframes the idea of blood as a normal bodily function rather than a symbol of danger. By overcoming this phobia, individuals gain the confidence to face medical care and emergencies without fear-induced paralysis. Thanatophobia. Thanatophobia, or fear of death, is not just fear of dying, but also fear of the unknown, non-existence, or what may follow after life. It can manifest as persistent anxiety whenever death is mentioned, avoidance of funerals or cemeteries, or obsessive worry about one's own mortality. Unlike other phobias that focus on external objects, thanatophobia often involves deep existential concerns. Aquaphobia. Aquaphobia involves a strong, irrational fear of water bodies such as oceans, lakes, rivers, or even swimming pools. For some, the fear is triggered by the thought of drowning. For others, it stems from a traumatic experience like being pushed into water or nearly drowning in childhood. Symptoms include panic, difficulty breathing, and trembling when near water, as well as avoidance of beaches, boats, or swimming activities. Aquaphobia significantly limits life experiences, preventing people from enjoying vacations, water sports, or simply learning how to swim. Treatment involves systematic exposure, starting with watching videos of calm water, then gradually moving toward shallow pools under supervision. Breathing exercises and relaxation training help manage anxiety.